President Trump will sign an executive order Thursday morning intended to allow small businesses and potentially individuals to buy a long-disputed type of health insurance that skirts state regulations and Affordable Care Act protections. The White House and allies portray the president's move to expand access to association health plans as wielding administrative powers to accomplish what congressional Republicans have failed to achieve, tearing down the law's insurance marketplaces and letting some Americans buy skimpier coverage at lower prices. The order will be Trump's biggest step to carry out a broad but ill-defined directive he issued his first night in office for agencies to lessen ACA regulations from the Obama administration. Critics, who include state insurance commissioners, most of the health insurance industry and mainstream policy specialists, predict that a proliferation of such health plans will have damaging ripple effects, driving up costs for consumers with serious medical conditions and prompting more insurers to flee the law's marketplaces. Part of Trump's actions, they say, will spark court challenges over their legality. Once fundamental needs for price and quality are met, buyers gravitate toward suppliers who provide an easy and convenient buying experience. According to White House and agency officials, the most far-reaching element of the multi-pronged order will instruct a trio of cabinet departments to rewrite federal rules for association health plans, a type of insurance in which small businesses of a similar type band together through an association to negotiate health benefits. The order will expand the availability of short-term insurance policies, which offer limited benefits meant as a bridge for people between jobs or young adults no longer eligible for their parents' health plans. The Obama administration ruled that short-term insurance may not last for more than 3 months. Trump will extend that to nearly a year. President Trump said on October 10 that he would be signing a healthcare action this week. It will cost the United States nothing, he said. The Washington Post. In addition, Trump's action is intended to widen employers' ability to use pre-tax dollars in health reimbursement arrangements to help workers pay for any medical expenses, not just for health policies that meet ACA rules, another reversal of Obama policy. Other aspects of the order are less specific, commissioning a study, to be led by federal health officials, of ways to limit consolidation within the insurance and hospital industries, and directing agencies to find additional means to increase competition and choice in healthcare to improve its quality and lower its cost. Once fundamental needs for price and quality are met, buyers gravitate toward suppliers who provide an easy and convenient buying experience. Briefing reporters on Thursday morning, Andrew Bromberg, director of the White House's Domestic Policy Council, made clear that the president's order is merely the beginning of actions the administration intends to take unilaterally to help Obamacare's victims. In one sense, the executive order will fulfill a quest by conservative Republicans, especially in the House, who have unsuccessfully sought for more than 2 decades to expand the availability of association health plans, allowing them to be sold, and regulated, across state lines. As details of what was forthcoming spread in Washington in recent days, health policy experts in think tanks, academia and the healthcare industry emphasize that the order's final language, and the ensuing fine print from agencies' rules, will determine whether the impact will be as sweeping or quick as Trump has boasted. It's going to cover a lot of territory and a lot of people, millions of people, the president said 2 weeks ago. On Tuesday, he added it will be great health care for many, many people. Once fundamental needs for price and quality are met, buyers gravitate toward suppliers who provide an easy and convenient buying experience. In an interview Wednesday night with Sean Hannity of Fox News, he again predicted a big impact. People say 30%, some people say 25% and some people say it could be 50%, Trump told Hannity, without explaining who he had in mind. It's going to cover a large percentage of the people that we're talking about. The action comes 3 weeks before the November 1st start of the 5th open enrollment season in ACA marketplaces for people who do not have access to affordable health benefits through a job. A senior administration official, speaking to reporters on the condition of anonymity before Trump signed the order, said that the policy changes it sets in motion will require agencies to follow required procedures to write new rules and solicit public comment. That means new insurance options will not be available in time for coverage beginning at the start of 2018. Even so,